You're tuned in to RX Radio.
So, sometimes you'll be having a conversation, like an argument or even just like a civil conversation. A conversation will end. And you just sit on it for a bit. And after a while, you're like, and another thing, and another one. And you just think of more things based off of that conversation that you just had. Yeah. Well, that's what this episode is. I promise you guys, this will be the last time for a while. You have to listen to just me and the insides of my brain. Though it's been very tame and relatively more pointed than I thought it would be. But this is just kind of a continuation off of last week's episode and the episode that kind of led to that episode a few months ago here where I talked about shoulder function. Last week I talked more so about lower body and how the core integrates with lower body and kind of building a gold standard of function around biomechanics, not necessarily around a specific individual, or using that individual as the measuring stick to compare themselves against, as opposed to just having this kind of nebulous idea in your brain. So both of those, those were ideas that I wanted to get out of my brain. And now, even though those were both selfishly for me, this one a bit selfishly for myself as well, but a little bit more generously for you, the listener. Both of those episodes were relatively theoretical, right? It's the base understanding that you need, the thought process that at least I take as I approach assessment and intervention around what I need to change with clients or athletes or patients that I'm working with. That's the way that I'll start to assess them against them so that we can start to make some sort of meaningful intervention in the way that they're moving, the program that they're following, the exercise selection, all of those things. Which is great because we should be thinking about these things. There should be a thought process or a framework that we go into these situations with, is that, okay, this is the way I'm going to think about this. This is the way I'm going to organize my thoughts and the actions that come from them around the situation. So this is the second part of that. This is the actions that follow that assessment. So I did mention at the end of the episode last week, there are very few exercises that I tend to use with the people that I work with. And that's literally the entire spectrum of people that have a desk job and have never lifted a weight in their life, people that are in professional athletics, people that are, weekend warriors and just kind of train for fun. Everyone, fucking everyone. I have a client that's 6'7", and then last week I worked on like a 4'11" little woman, a 60-year-old woman. So it's like literally everyone in between those bookends I've worked with. And I can tell you for a fact, there's not that many exercises that you need to understand and be proficient with to be able to help anyone on that spectrum. So we'll dive into it in just a bit here. But if you guys are listening right now and you haven't taken the Prescript Level 1, what I want you to do is go over to the website, www.pre-script.com. On the homepage, you'll see that the Prescript Level 1 is not currently for sale, but there is a waitlist there. If you put your email on that waitlist, we will email you, first off, some great content, mostly written by Eric Bagheera, one of the smartest people I know, for getting on the newsletter. But when the Prescript Level 1 does go for sale, you'll be the first to know. We'll be right in your inbox, and we'll be in your inbox with the only available discount for that course. All right. A lot of the ideas and the principles that I'm talking about here, these obviously have their roots in the Prescript Level 1. And the Prescript Level 1 will give you the entire framework for decision-making around training. So if you're not on that list, if you haven't taken the Level 1, go over to the website, drop your email right now, and we'll let you know, and we'll give you a discount on the Level 1 when it goes for sale in like 2 weeks. It's not that long. So hit the wait list. And yeah, we'll see you in class. But for today, I want to talk more around exercise intervention and how to make these ideas around assessment a bit more actionable, right? Is that great? Once we understand what's going on, that's part of the puzzle. But from there, if we don't have any action, or if our action doesn't match the intention of what's going on or what we need to correct, then it doesn't fucking matter. And that's something that largely people are terrible at. And people that get paid to do this. And I'm not necessarily talking as much personal trainers, because what I've found in my experience is that a lot of personal trainers, though they might not have extensive medical, anatomical, physiological training, they're very intuitive in solving problems. And that's something that I really admire, is that being able to solve a problem, even if you don't really understand the underlying mechanism of what's going on. Sick. A lot of respect for that. But there is the large majority, and in the training space, yes, but of the rehab, PT, chiro space, of people that are very well versed in the anatomical side, in the objective side of understanding exactly what's going wrong, but they have a shit way of going about fixing it. A lot of physical therapy and rehab, it leaves off way too soon. It could be a matter of maybe, yeah, someone that doesn't understand what they're doing, or understand how to get someone not just back to a level of function that their insurance says will suffice, but actually getting them back to doing the things that they want to do, or even a higher level of function that they came in before the injury with. But so that's kind of my gripe here, is that people can really understand and identify exactly what's going on, but they don't have the tools to get them to the place that they need to be in terms of functionality, in terms of capacity, in terms of strength. And I see this a lot working with an athletic population, or in the population of people that live within the realm of strength sports, is that, okay, they'll have an injury, they'll do the rehab with someone, and a lot of that rehab is just very low stimulus stuff based off of like literally the same shit you would see on ChatGPT. Like, ChatGPT, write me a rehab program for a sprained ankle, and it'll be exactly that. It'll be banded exercises, passive range of motion. It'll be very low stimulus exercises that are going to get someone to a point where they can probably get through the range of motion that they need to be able to get through, so that insurance says, okay, you have finished your rehab. But there's still a deficit in terms of function through that area, or a deficit in terms of they've had a lower level of function through that area, so they haven't been weight bearing on that side, and now they've developed a bunch of compensations around that, but they're not necessarily aware of those compensations, so that's just how they move now. And that's like, anytime you've heard someone say that they had a herniated disc in high school and now they just have a bad back, okay, maybe, but probably not. Probably what happened is, yes, you hurt your back in high school playing football, and there was a traumatic injury, an acute injury that occurred there. I'm sure that has since healed for the majority of people, but you never learned how to move in a way outside of that compensation pattern that you developed in the time where that was an acute injury and it was flared up. And that stuff, when people have like a bad shoulder, a bad back, a bad knee, that's what plagues them. It's not the knee, it's not the shoulder in the majority of these cases. Like, yes, there are some where, all right, you fucked your shit and you're gonna have to work around that indefinitely now. But the majority of the time is people dealing with a compensation pattern that has that they're left with due to an incomplete rehab process. So that's kind of where we're going to tie these things together today. We're going to talk about not just the rationale that I laid out in that episode I did on the shoulder, the episode I did last week on the lower body, but actually how you can get people back to a sufficient level of function. And it comes back to what I defined as a biomechanical gold standard, right? In terms of movement, we have a gold standard of the way that we want someone to be moving. Oh, this is hilarious. Yeah, let me see if I could do Shallow's FaceTiming me right now. Yo, hold on. I'm recording a podcast right now. Can you say hi to all of your fans?
Hello, everyone in RX Radio land. It is I, I will be returning to you shortly. Thank you for your patience as I deal with my life.
Yeah, let me give you a call back in like a half hour.
Okay, love you. Bye.
Love you, man. All right. So, co-host Jordan Shallon making an appearance. All right. So, before I got derailed there, talking about a standard of function based off of biomechanics that we need to be able to identify and create in people. And I'm going to put this as simply as I can, right? We need to be able to control movement, produce and resist force through all three planes in each body region. Okay, that's all we're trying to do. All right. So what that looks like, as I outlined previously, what we're trying to do is this is going to start from the core, right? If we don't have a good ability to do this through the core, then it's going to blunt our ability to do this downstream. Okay, so that's at the hip, knee, ankle, at the scapula, shoulder, elbow, wrist, wherever we're trying to do this. So basically, through the core, we need a level of control first, an awareness, a conscious awareness of controlling the core musculature through all three planes to create and resist movement. Okay, then from there, we're going to coordinate the hip and lower limb, and we're going to coordinate the scapula and upper limb, while maintaining that control through the midline. Okay. So as we start to look at how we're going to do this, the reason I said that we need this to be conscious is because a lot of people get into their athletic career, their training career, without really understanding what they're doing, with just kind of trying to carry out movements and actions that look like the thing that the person that's telling them to do the thing is doing, without a complete understanding of how they can do that and how they can be successful in that. Right? So it always comes down to teaching people how to use their core first. Okay. So a couple things that I really like here, and this is best done isometric static first. I like a supine 90-90. So someone's lying on their back. They have their hips and knees bent to 90 degrees, heels on a bench. And then from there, what I'm going to have them do is basically a sit up where they're pushing their low back into the ground and they're feeling their abdominal musculature activate. Now, a lot of you that have probably been training for a long time, if you were to do this right now, I'm sure there's a high percentage of people that as soon as you got in that position, you would start shaking, you would start convulsing, because you don't have the level of exposure to this position that your body deems would suffice for saying that, okay, we can control this position. And any of your clients that don't have an understanding of this, if that's something you have a frustration with them with, they're going to understand real quick that, oh, this isn't the position that I'm putting my core in as I'm doing anything with load. So that's number one for me. And that's really easy to execute on because they're lying on their back. They're lying on the ground. There's very little movement. All you want them to do is feel that core activation and then start to make a conscious awareness of what it feels like to activate those muscles. All right. And that's something that very low stimulus, but the benefit that we're going to get, the adaptation, is it's not necessarily muscular adaptation here. It's an adaptation of awareness and consciousness, and it's learning, right? It's motor learning is what we're doing. So we want them to be able to understand that feeling. And yes, you could do your side planks, your Palov presses, but I don't find those as useful in terms of learning, core bracing as I do this movement, right? It's sagittal plane. This is something that we can get them to start to associate with lower body hinging, lunging mechanics, upper body pulling and pressing mechanics. So this is kind of the core of all of it. And then as I look at progressing this stimulus, once they have that understanding, literally just flip them over, have them do a plank, right? They're just using a greater proportion of their body weight against gravity. But now the difference is they have the ground constraining them into position. Now they have to consciously understand how to create that position floating in space, right? No different than you would with an RDL, with a walking lunge, with a half kneeling dumbbell press, right? So that's another learning component for them. Okay. So first they need to learn what muscles to use. Second, they're going to scale that stimulus, but they're also going to have another learning component of, okay, now I don't have the ground as a tactile cue, some tactile feedback for me to understand how to stabilize my lumbar spine. Now I have to create that position. And once they have proficiency there, two movements that I think are a really good way to build off of this would either be like a bear crawl or a sled push. And not sled push in terms of a ton of weight, just in terms of, with both of these movements, we want to create the same static core positioning. But now we're starting to integrate upper body and lower body mechanics in this. And that's where we start to bridge the gap from, just focusing on core bracing to understanding how to use our core to facilitate lower body movement and upper body movement. So that's kind of the gateway to any of this, is getting someone to understand how to stabilize their core. And this is how I do it. I'm not saying it's the right way. I'm not saying it's the best way. I'm sure plenty of other people do it different ways and better ways than I do. But I found a lot of success with doing this. And more importantly than the actions, the specific exercise here, it's the intention, right? We need to bring conscious awareness of what muscles they need to understand how to engage, consciously understand how to engage in that first variation. In the second one, we need to challenge their ability to create that position without tactile constraints or tactile cues. And then we're going to start to integrate that core positioning into upper and lower body mechanics. That's it. Whatever movements fit into those boxes or into those categories, they're the ones that we're going to choose. Now, as we start to think about how this is going to radiate into upper and lower body, we're going to use that same rationale. We're going to put people in constrained positions to execute on the thing that we want them to execute on. Of course, that's going to be the thing that is the learning piece of all of this. We want to put them in a position to have a high level of success early on so that they can build awareness with that specific movement pattern, how they should be moving, what they should be feeling, which is a really important part early on, is we want them to be attuned to the sensations of activating specific muscles, so that when we associate, scapular mechanics of a scapula push-up to a push-up or a dumbbell bench press, that they have an understanding of the way that they're going to stabilize specific body regions as they do that, because they've felt it before. Something I want to take a quick pause and kind of an aside with all of this before we get into upper body, lower body specifics is there's this idea of functional training or people thinking that specific movements are functional, and that's a very kind of convoluted, cloudy term when it comes to exercising. I think anything that's not a machine is kind of clumped into being functional movement. But there's this very low quality definition of function. CrossFit's a big one for this, because they really deem like a squat as a highly functional movement, because if you want to get off the toilet when you're 60 or when you're 80, however fucking old people die at, then you need to be able to squat. And I would very much challenge that, because it's a pretty cheap definition of function, right? Like, if the function of your lower body is to get off the toilet, I guess, yeah, that would make it a functional movement. But if we let our skeleton, and again, the way that our joints are oriented, the way that our body functions as a system, dictate our definition of function, biomechanical function is actually blunted in a squat, right? Our legs do not necessarily work to the best of their ability as we're doing a bilaterally axial loaded movement. There's a lot of constraints around that. The number one thing being both feet on the ground at the same time. That's the reason that's not necessarily functional, is because there's going to be a degree of compensation on one side or the other. I lied, on both sides as we go through this, that we can hide in, right? And there's going to be kind of this scale of, are we loading functional tissue, as in, are we loading musculature, tendons, or are we loading more structural tissue? Are we loading joints and bones and cartilage and ligaments? So if we're looking at something that is a higher degree of function in terms of something that is sustainable movement that we can do for a long period of time while incurring as little collateral as possible, that's not going to be a squat, because anywhere where there's a compensation from one side to the other, then we're going to actually unload musculature and we are going to load structure, which we talked about in the previous episode, where as we load structure, it actually causes breakdown of structure, as opposed to when we load muscle, it's a favorable adaptation where we're now getting stronger. So if we look at function like that, like the way that our hips are going to work best are going to be kind of counter rotating from one another, right? Is as we go through, hip, that arc of hip flexion into hip extension, as we flex the hip, there's going to be a vector through all three dimensions there, right? And same thing as we extend the hip. So something like a unilateral squat or a walking lunge is going to express a much higher degree of biomechanical joint function, where we're loading tissues that are going to have a positive adaptation. It's going to be more sustainable. There's going to be less collateral than if we're doing a bilateral movement like a squat. So that's kind of a big idea as we start talking about people that are coming to you with a discrepancy in function. Another example I have of this, is last summer, I was doing an off-season camp with some of the NFL players we work with in the level 3, and I was asked to do an assessment on this guy that had just had a ACL repair 6 months ago. He was there with his strength coach. This is a professional athlete in the NFL, coming in with his own strength coach from the team he was on. And before I even kind of got into assessment, I started talking to a strength coach. And I was asking how he was doing, like, how the rehab process has been going. And then I asked him what the program looks like. And this motherfucker had this professional athlete who he got signed for a lot of money. He just got a contract extension. It's a lot of money this past year. But his rehab program that this strength coach that works for the team wrote for him had him squatting 3 days a week, 6 months post ACL repair, bilateral, like barbell safety bar squatting. Now, the issue with that is that the compensation is still very present. If we're talking an ACL repair, there's a period of time where you're walking differently, you're bearing weight differently through the side that doesn't have an ACL than you are the one that does, right? And there's going to be a compensation around that in terms of pelvic rotation, in the way that you're loading through the hips, in the way that your foot strikes the ground, the musculature you're recruiting to just go through gait cycle, the way you get out of your car every time you stand up, the way you get out of bed, the small kind of low stimulus things that you do on a day-to-day basis. Then what they're going to do, they're going to cut open your leg and they're going to put like a pig's ACL or some shit in there, or a dead person's ACL. And then they're going to immobilize you for, 4 to 6 weeks. So now there's a 4 to 6 week period post already developing a compensation around that injury, where you are not getting the proprioceptive feedback of that foot touching the ground, right? You're not feeling the stretch shortening cycles of using the muscles that cross the knee, the ankle, the lower leg, the hip. You're basically creating a scoliosis over top of the leg that you can walk on in that amount of time so that you can get around. That's very functional. How about that, CrossFit? That is very functional. That gets you around while you're on crutches and you don't have an ACL. But then when that heals and you're not on crutches and, we're 3-4 months down the road, there needs to be a lot of specific work to build that proprioception back. Your nervous system is going to be very protective of that area, because the majority of the stimulus that it has gotten over the last, 6 months at this point, was that we should not load weight through this knee. So if I just go back and I put a barbell on my back, say it's my left knee, I'm going to squat through my right side, and I'm going to put very little weight through that left side. And there's going to be probably a hesitancy to get into deep knee flexion there, which is going to create a pelvic rotation where I'm probably driving that hip back and my other side knee forward a lot, and it's just going to create this rotational squat pattern. That's not what we're looking to do. We should not be doing squats as rehab, right? We need to be looking at, okay, what is that gold standard of function through the lower body? And that's being able to get through that entire arc as we go through flexion, external rotation, abduction, as we go through extension, internal rotation, and adduction on both sides to a relatively symmetrical degree. Right. And then aside from that, as we're talking like ACL, we need to be able to actively flex the knee through that entire range of motion at which we're looking to load. So that's probably going to be a lot of isolation at first. And then as you get that active range of motion back, then you're going to have to start to build that coordination between the hip musculature and the lower and the thigh and the lower leg to be able to coordinate this into something that looks like even a lunge before a squat. So kind of taking it back to the original point is that we don't increase function through bilaterally loaded movements. So that's squats, deadlifts, overhead pressing, barbell rowing, things like that. That's not going to give us the ability to increase function in terms of the way that biomechanics dictate the way that our joints should function and create and resist force through all three planes, because there's going to be some sort of a compensation to accommodate for that means of a fixed surface there. Okay, so back to the original point is that anytime that we're doing this and we're working through increasing function on a joint level, it should be done unilaterally, one side at a time. And for the most part, this should be done open chain, right? Dumbbells, open chain with a lower body, like like a walking lunge or a lunge position, open chain, meaning that I have the variability through one end of this system. It's not a fixed system. It's not both. If I'm squatting, my pelvis is pretty fixed because of that axial load. My feet are very fixed because of their connection to the ground. So there's not really the availability to adjust positioning here. Versus a lunge is that I'm able to create rotation through the hip dynamically as I go through this movement, right? And that's what hips do. That's how we're going to train through that whole entire range of motion that our hips allow us. So as we go through this, let's talk about how we can arrange this into exercises that are meant to help us through these things. Okay, so number one is going to be the core, which we already talked about. If we can maintain the core position that we need to, the rib cage over the pelvis, that stacked orientation, create core tension, and resist movement through all three planes, that's buy-in. Now, as we talk upper body, we want to work through all three planes of the scapula. Right? And we need to do this in a way where we're scaling the stimulus, just like we talked about for the core. So as we do this, the scapula predominantly, like the easy way to think of scapular movement is protraction, retraction, so front to back, elevation, depression. There needs to be a conscious awareness around the muscles that it takes to recruit, to create these movements of shoulder blades up, shoulder blades down, shoulder blades forward, shoulder blades back, before we can really coordinate that into something more complex as scapular upward and downward rotation. So where I'll start with these, because they already have an idea of how to use their core, because we already went over that, would be something like front to back. We're talking like a scapula push-up. As simple as that. Just understanding how to create stability with the scapula on the rib cage and move that front to back. Top to bottom, scapula dip. Hands on a bench, get them to relax into shoulder elevation, get them to push down into depression. Have them do these until they have a complete understanding of how to maintain core tension while move the scapula around the ribcage. And then from there, we can we can increase the stimulus in this kind of low tier scapular stability with actual exercises. So we do this in their warm up, we build an understanding of what it feels like, and then we double down and we load it in their actual workout. And that could be something like a push-up where they're getting into protraction, or a dumbbell press where we're encouraging protraction at the top. And then it could be something like a chest supported row where we're getting them to eccentrically load into that protraction. So they're eccentrically loading more the upper back here, but we're getting into full protraction. And then from there, we're actively retracting the shoulder blades. And that's an easy way to scale that stimulus and build capacity to hold these positions. Then from there, we need to get them to upwardly, downwardly rotate that scapula, because that's going to be the highest level of function. Is hands overhead. Same idea with the shoulder. As we get into scapular upward rotation, we're going to pair that with shoulder flexion, external rotation, and that's about it. So shoulder external rotation as we get into shoulder flexion, and scapular upward rotation. As we get into scapular downward rotation, it's going to be shoulder extension and internal rotation. So that's our standard of movement, and we're looking at that right versus left. And as we get into this, yes, there's going to be a kind of method that we use to increase the capacity, and then we increase the stimulus, and then we increase complexity last. So once they have that understanding of protraction, retraction, then we're going to coordinate that into upward and downward rotation, right? So as we get into upward rotation, these things, I find it easiest to teach them, this one specifically, through eccentric load, right? So that can be a high cable unilateral pull down, where you're getting someone to get into greater than 90, ideally closer to 120 or more degrees of shoulder flexion, and manageable load, of course, but we're teaching them how to maintain external rotation. So we're trying to keep that elbow essentially pointing down towards the ground, and then controlling scapular position as they lengthen through the lats, as they get into shoulder flexion. And the benefit there is that eccentric load is going to give them a very good stimulus of control. The reason that people have a hard time getting overhead is because their nervous system senses that they don't have control over that position. So as we start to control that eccentric load, we want to make sure that there's an understanding of how to stabilize the scapula. And basically what I'll tell people scapular stability is, as we go overhead, it's an intention towards depression, but we're still allowing that scapula to rotate as we go. So it's kind of a shitty definition, but there should always be this intention to pull the scapula down the back, but not necessarily lock it into place there. We're still allowing it to rotate, but as long as we have that intention towards depression, we should be rotating appropriately, using the serratus anterior to pull that inferior angle forward, using the rhomboids to pull that superior border inward. So we're creating that proper scapular upward rotation, but that scapula is sitting flush on the rib cage. And that's something that their capacity to do will increase over time. But the thing that's going to allow it to increase is that stimulus of control, that eccentric load. So that's why I really like that series of movements there. And then I'll pair that with a half kneeling landmine press. So landmine press gives them some sort of external support, something to leverage off of to create scapular stability. The half kneeling position makes it a lot easier to execute on maintaining spinal stability. And then you simply just have them press this up, keeping that wrist stacked over top of the elbow so that they're maintaining that a degree of external rotation. If you see that wrist coming inside the elbow and the elbow flaring out, then they're starting to bias internal rotation. So they're losing glenohumeral stability as they go through the movement. They're starting to bias internal rotation. So just pair that with a landmine press, and all you're doing is you're only having them press up to the point where they can maintain the orientation through the rib cage and the pelvis that they need to be able to stabilize that rib cage, stabilize the scapula on the rib cage. And you're only having them press up as far as they can while maintaining that stacked wrist over elbow, showing that they can control the rotation. And that might not be very far. That might be 90 degrees at first, but you go back set over set, session over session, week over week. And over time, this will improve as long as there's a stimulus of control, right? And there's a conscious awareness of how they're moving, how they're creating these positions all the way from the core to the scapula, through the shoulder, and then intention around position as well. And that's kind of the formula that I use for the upper body. And the thing about this is I don't care what your training goals are. This will help you. This, whether you're a strength athlete, whether you're playing some sort of field sport, ball sport, whether you're a competitive bodybuilder, it doesn't matter. A higher level of function and proprioceptive awareness through the core, scapula, and shoulder is going to benefit you in whatever you do athletically. I can guarantee you that you will have better results in your training, the higher level of function that you have in these areas, and the better of an understanding that you have of how to coordinate these things. It doesn't matter what you're doing. It doesn't matter if you're a power lifter and you only bench press, you never overhead press. If you can get into this position overhead, you're going to have a greater degree of freedom to rotate through the shoulder, which is going to allow you better variability in the way that you can create stable positions through your bench press, as opposed to be pigeonholed into the positions that you have to move through because of a lack of stability, a lack of range of motion, a lack of awareness or proprioception. That you're going to have better results in your training, and you're going to have a better level, a higher level of output because of it. And then I'll do a very similar thing in the lower body. I guess we can talk about a couple different like progressions and loading parameters in the lower body, but the idea is the same. Is we need them to understand the core positioning and then how that associates to lower body positions. Everyone who's ever listened to this podcast has probably heard me talk about the B stance RDL because it's one of the GOATs. I think like overhead pushing, pulling in the upper body is something that we need to be able to increase someone's capacity to do those things. Yes, absolutely. And I look at it the same exact way as unilateral overhead pushing, pulling in the upper body. Same thing in the lower body, right? The reason I like a B stance RDL is because it allows us a greater degree of rotation in the hip versus, say, a dumbbell or a barbell RDL, so that we can now move through a more full range of motion at the hip, and we can start to build, again, we can build a stimulus of control over eccentrically lengthening the external rotators in the hip, right? And that's something that if we have instability in the hip, a lot of times that's going to manifest as an external rotation bias. So shortening of the external rotator group in the hip. So it's a really easy way to start to build eccentric length and then allow us to move more freely through the hip. A couple things we need to work on here is that I kind of stopped saying this a long time ago, but I'm always saying to use a contralateral load with this. Like, I just assume that people are using a contralateral load until I walk into the gym and I look at the dumbbell rack, and then there's like some fit chick with an 8-pound dumbbell doing these like 90-degree angles everywhere with an ipsilateral load. There's a very limited utility to using an ipsilateral load in a B stance RDL. In my opinion, if you guys have a different opinion, let me know. But the only time really I'll use an ipsilateral load is if someone has such a low capacity to move that they need a contralateral support. And I've progressed this as much as I can in terms of volume and tempo without loading, that now I need to load, but they can't actually, they can't give up that contralateral support just yet. So I'll give them a contralateral support and I'll give them an ipsilateral load. But the issue with the ipsilateral load is it's deviating their center of mass outside of their base of support in a way that makes it opposes the joint mechanics, right? It opposes the way that we should be striving to move to lengthen those lateral hip rotators. And it's pulling them into a position that they're probably already biasing. Most people, again, if we have instability through the hip, it's probably going to manifest as our hip external rotators resting at a shorter length. So as we go through in a ipsilaterally loaded B stance RDL, that load is pulling me into a greater degree of external rotation, which I already want to be there. So it's making it really easy for me to do the thing that I don't want to do, the exact thing that I don't want to do. So that's something where still, if I'm giving them an ipsilateral load, I'm giving them an intention to use that contralateral support to pull them into a degree of hip rotation that still creates length through those hip external rotators. So that's a bit of a side, like something I want you guys to think about where you're assigning load with this and how you're assigning support. And then the progression from that would be, okay, we're going to switch to an ipsilateral support, and I'm going to give you a contralateral load. So that's going to now start getting them in a position where the load is now encouraging them to get a greater degree of internal rotation at the hip, lengthen the hip external rotators, and it's starting to align with the intention of the exercise, which is exactly that, to help them understand how to create more length in the lateral side of the hip. And the lower body, that kind of the analog to that is going to be a split squat or a lunge, right? The gold standard in my mind is a walking lunge. If you can get someone to do a walking lunge in stable positions through the core, finding stable foot pressure, and start to load it, dumbbells in their hands, they are there. They have reached the gold standard of lower body function. Have them continue to do walking lunges forever, and they will be great. The issue is that people will compensate, and compensation here looks like movement through the core, and it looks like movement through the foot if they're not able to maintain foot pressure. So we start with a more stationary variation, whether that's just a stationary lunge or a split squat variation. And understanding the loading parameters for these things is what makes it effective, right? Same idea here. There's not too many situations which I'm going to give someone an ipsilateral load here, right? Because that's just going to pull them into greater external rotation. And that's it. It's going to make it harder for them to execute on the intention of someone, of the intention that I'm assigning for someone that has a poor understanding of how to execute on this. So if we're looking at loading parameters, the only time, again, and if you guys have a difference of opinion on this, let me know. But where I'm at is typically I'll get someone into positions with external support. We'll start with bilateral support. And really what I'm looking at is their ability to maintain full foot pressure as they in the front foot as they lower and raise. With that, you should see a bit of a flattening in the foot as they go down, a little bit of a raising in the arch as they come up. But you want to be careful with that, because as that foot flattens, we want to make sure that they maintain pressure through the whole ball of the foot. As that arch rises, you want to make sure that they maintain that first toe so that they're not wobbling through that front foot. As we look at the back foot, we want to make sure that they can get into, first off, hip extension, right? I've seen too many people do lunges where they'll get into a lunge and their rear hip is in flexion, which, again, depending on intention, that could be perfectly fine. Like I'll do split squats where my rear hip is in flexion, but my rear hip is only there for support. I'm not loading that rear hip at all. All of my load is on the front foot. And that's something like that's totally fine. It just depends on intention. But if our intention is to increase function bilaterally as we go through this, then that rear hip should be an extension, and I should be bending through that rear knee. The thing that will prevent that on a lot of people is excessive quad tension, is that, we get into a very lengthened quad position as we maintain hip extension with knee flexion, right? So if their quad isn't able to tolerate that level of eccentric load or that level of lengthening, then they're either going to bend at the hip, or they're going to straighten out the knee, or they're going to do both. So that can tell you a lot about someone's level of hip function, is their level of hip extension. So honestly, where I'll start with this is static first. I'll have people do isometrics and create these positions, and then it's bilateral support. Once they can execute on that, if they have like really shit capacity, I'm going to give them an ipsilateral load with contralateral support. And then once they start to build up a bit of capacity there, then I'll switch sides. It'll be a contralateral load with ipsilateral support. And then from there, we're just moving on to contralateral load. And that's the way that I would go through a loading progression with most people. There is, depending on what we're trying to do, the idea of anterior posterior loading. Yes, absolutely. I'd say what people are going to need most often in lunge variations is going to be an anterior load, and that's going to allow them to sit into that back hip a bit more, kind of shift their center of mass back a bit to encourage better hip extension. That's something I'll do with isometrics, and then you could also do that with dynamic lunges as well. But I use that as more of a learning tool than an actual loading progression, just because there's a bit of the progression gets a bit blunted on that. You're never going to get super heavy with that type of like goblet loaded progression. And once you have that level of function, then you can just move on to something that's going to dynamically load through that range of motion and still retain the level of progress that they're having there. And then as we talk about kind of anterior posterior loading, we can also look at constraints around foot position, right? Do we have a rear foot elevation? Do we have a front foot elevation? Are we on level ground? Are we using heel wedges? All these things, they're basically just going to manipulate someone's center of mass. So if someone's kind of always falling forward, we want to put something in place to get them to leverage off of to push back. If someone has a hard time letting themselves come forward, then we want to put something that's going to give them something to leverage off of where they don't have a choice but to go forward, right? So if we put the rear foot on a bench, then they have to put their weight on that front foot, right? If we put their front foot on a plate, then they have to push their weight back into that back foot. If we put a heel wedge in, that's going to force them to drive that knee forward. If we put a wedge under the toe, it's not going to allow them to drive that knee forward. So hip's going to go back further. So there's all different types of loading parameters and constraints that we can have around these things. But this is where it becomes a bit more specific in, okay, we understand that we need to get people to move through, flexion, external rotation, abduction at the hip, extension, internal rotation, adduction at the hip. Now, these are the things that we can get them to dial in the variables around that with. So if we have someone that's having a hard time extending the hip, then all right, I want to put into place variables that are going to allow them to shift weight into that back leg so they can start to load that in a way that's going to force them to stabilize through hip extension. So that could be anterior load. That could be front foot elevated. It could be a wedge under the toes. It could be any of those things, something that's going to allow them a greater stimulus through the back leg or make it more apparent to them the stimulus that they need to feel through the back leg, right? So all these things, all these variables, this is where what it comes down to. Once we understand that, okay, there needs to be a level of function, right versus left, we're going to have to obtain that unilaterally, right? Because bilateral movements aren't going to allow us that full amount of rotation that we would if we were going unilaterally. And then through this, the first step is active awareness, right? We need to build awareness, conscious awareness of what they need to feel to stabilize specific areas. Then we need to have them associate that to, stability through the midline while being able to dynamically move the shoulders and the hips. And then from there, we start to dial in each of these variables around constraints based off of the specifics that we're seeing with that specific person. Do they have a hard time internally rotating? Do they have a hard time externally rotating? Do they have a hard time getting into flexion, getting into extension? How can we use a stimulus of stability, or a lot of times isometrics or eccentric loading, to get them to feel more comfortable in that position? And then can we overlay that with something that's going to force them to actively put themselves into that position? And that's kind of a bit more actionable idea of how I look at these things. And the idea of this is that this framework fits everyone. This is something that I don't care who it is. I'm programming for them with all of these things in mind. It's just the things that aren't this are the things that are going to make it more specific to that person, right? Maybe this is someone that, they're an athlete and they need to train power output. So maybe they're doing plyometrics. Maybe they're doing bounding. Maybe they're doing high force output things, or it's a power lifter. So we're doing more sport specific things on the barbell outside of this. Those things can happen simultaneously, but this is a piece of everyone's program that's going to give them that ability to move in the way that they need to move for a longer period of time, because they're moving by loading functional tissue. And there's a high level of sustainability with that because they're loading musculature and they're not incurring as much collateral through the joints, through the inert structures like the bones and the ligaments. And that's really all I want to come on here and say. So if you're still here, I appreciate you listening to this. I won't do this to you for a long time. I got some guests lined up next week, and you heard Shal himself. He'll be back in the near future. But I appreciate you guys listening to me as we went through this. Oh shit. Let me close this out. I appreciate you guys listening to me as we go through this. But if you guys haven't signed up for the waitlist, sign up. Go over to the website www.pre-script.com, and we'll talk soon.